So when I got back into when I finished the PhD and then continued back into medical school, this was now doing all the medical rotations. So I really had a chance to see, okay, what are the main questions being asked, and is our research really answering that question? And it was about 50-50. I think at that time, the genome had just been sequenced, and so all of these kind of personalized medicine and molecular profiling that we do routinely today was just at its infancy then. And no one knew what to do with it. And then everyone's like, well, what if you have it? What do you do with it? How do you tell the patient? How do you tell the patient's family? Is this genetic?
About what?
If they have genetic mutations that are driving their cancer, or they have certain molecular profiles that indicate that they're going to respond or not respond to therapy. So I ended up doing rotations in medical oncology, and I focused heavy on the cancer world, maybe to my detriment.
Why? You're specialized. What's
specialized, but when I was so focused, I'm like, I want to get to know everything about oncology, and I think I lost some other aspects of what medical school training is supposed to be about, being trained as a whole doctor. I think a lot of the stuff that I kind of passed along now, I'm kind of trying to relearn now because I see how much it's integrating into my clinic now. So I'm actually going back and relearning a lot of those things that I don't have a heavy hand in the clinical decision making, but they certainly impact the quality of life and the clinical outcomes of my patients. So I ended up doing rotations, heavily focused on medical oncology, surgical oncology, radiation oncology. And the two things that I really fell in love with were radiation and surgery. The problem was I was already so starting to go into burnout a little bit, being already 6-7 years into schooling, and then I had to look and see what the rigors were of these two fields. And radiation oncology at that time was highly competitive. Fortunately, I had a lot of research, a lot of publications, and that's kind of where radiation oncology was going, and they wanted more of these kind of research focused residents. And I looked at surgical oncology as well, and the lifestyle then was very rigorous, doing 5 years of general surgery and probably another 1 to 2 years of surgical oncology. I was looking at that as, it wasn't that I didn't have the interest. I was like, do I have the energy to be able to do that? And then you look at radiation oncology, it's basically, you start specializing in oncology from year 2. You do 1 year of internship, and then you're 4 years of just straight out oncology. So you're specializing immediately. Lifestyle is definitely better. And I don't want to say that that's really what impacted my decision, but I had to weigh all these factors to say, what am I actually going to get through this? And I said, I think I can get through the radiation. And fortunately, because of my research, that did score me some interviews that maybe I shouldn't have gotten. I finally got better at taking tests and actually had really decent board scores that allowed me to be competitive. But I ended up getting into Wayne State radiation oncology program, so I did complete that. Now, at the time, I needed to figure out what exactly I was going to do. So do I want to stay in academic medicine? Do I want to specialize? It seems that if you really want to make a name for yourself in academic radiation oncology, you have to pick 1 or 2 disease sites and really focus on them and learn how to treat that and become an expert at that and start to publish that. So I really had a strong interest after doing all my rotations in radiation oncology in the GI world. I thought that was gastrointestinal oncology. So that includes anything from esophagus, stomach, pancreas, bile duct, liver, colon, rectal, and anal cancer. And I was like, this is just, you're a specialist in GI, but you're also going to know 10 different disease sites just from seeing all these patients. And so when I was looking for jobs, there were 2 academic jobs that were available that were allowing a GI focus, where basically you were only going to treat GI oncology patients. And after it was all said and done, I ended up choosing Moffit Cancer Center, and they did hire me in 2009. So I spent 2009 to 2014 at the Moffit Cancer Center. Had a great mentor there, Sarah
That's
Hoff.
in Tampa, right?
That's in Tampa.
Yeah. I've heard of it.
Yep.
Yeah.
And I was treating just GI oncology patients. My mentor and I helped to kind of advance the program, integrating new and novel radiation techniques like stereotactic radiation therapy for pancreas, using radioactive glass microspheres to treat liver cancer. And so this really kind of put us on the map. We were getting invited to give talks, we were publishing a lot. And as with all institutions, they kind of go through this kind of rollover, there's frustrations and people leave, and an opportunity arose here at Florida Hospital, now Advent Health, at the time, where they were replacing their entire radiation oncology program to become more academically focused.